I'm going to continue about the MRCP basis consultation and going to discuss about how to approach an angry patient in your MRCP basis consultation station. So let's move on. Here is our scenario. You are a registrar in a busy outpatient clinic. Mr. Johnson, a 45-year-old man, is scheduled for a follow-up appointment regarding his chronic back pain. He is frustrated with the perceived lack of improvement in his condition and is visibly angry. Your task is to address Mr. Johnson's concern, manage his anger, and ensure effective communication. So this is your scenario. So how we're going to approach a case of angry patient, who in your MRCP basis consultation station. So first of all, you have to acknowledge the patient emotions. So greet Mr. Johnson with empathy and acknowledge his frustration without escalating the situation. So you can say something like this: Mr. Johnson, I can see that you are feeling frustrated and I am here to listen. Let's discuss your concern and see how we can work together to address them. Okay? So this is the first step. The second step is active listening. So in this, we allow Mr. Johnson to express his feelings and concern. Use empathetic statements to convey that you understand his perspective. So here you can say something like this: I want to hear more about how you have been feeling and what challenges you have been facing with your back pain. Your perspective is crucial in finding the best way forward. You can rephrase it, and whatever wordings is suitable for you, you can just apply it here. But remember these steps. First of all, acknowledge and do some active listening. Then in the third step, we're going to validate the patient experience. So validate Mr. Johnson experiences by acknowledging the impact of chronic pain on his daily life, and this helps build rapport. So you can say, chronic pain can be incredibly challenging, and I understand that it has a significant impact on your daily life. Your feelings and experiences are important. So third step is validate the patient experience. Then you're going to empathize and express the understanding. So demonstrate empathy and understanding by expressing that you recognize the impact of his condition. Something along the lines: I want you to know that I hear your frustration and I am committed to working with you to find the most effective approach to managing your back pain. Okay. Then the fifth step is apologize if appropriate. So suppose if there has been misunderstanding or Mr. Johnson expressed dissatisfaction, consider offering a sincere apology. You can say like this: I'm sorry to hear that you are not experiencing the improvement you had hoped for. Let's explore why that might be the case and discuss potential adjustments to your treatment plan. So once you have apologized, then the next step is we need to clarify the treatment goals. So clarify the treatment goals and revisit the expectations. Ensure a shared understanding of the management plan. Something along the lines: let's take a moment to revisit our treatment goals and discuss any modifications that might be needed. It's important that we are on the same page regarding your expectations and the potential outcomes. Okay. And once at this stage, most likely you have developed some rapport with the patient, then you will move to next step, which is collaborative decision making. So involve Mr. Johnson in decision making process and discuss alternative approaches or modifications to current treatment plan. I value your input and I believe our collaboration is essential in finding the best way to manage your back pain. What are your thoughts on trying some alternative approaches? or making adjustments to your current plan. And then you're going to offer some solutions. So propose practical solutions or modification to the treatment plan that align with Mr. Johnson's preference and lifestyle. Let's explore some potential adjustments to your treatment plan that may better suit your needs. This could include considering alternative therapies or making changes to your current regimen. Okay. So we're going to offer some alternative solutions. Then going to address any misunderstanding. So if there are misunderstandings or gap in communication, address them and provide clear explanation. You can say something like this: if there has been misunderstanding or if aspects of your treatment plan were not clear, I want to ensure we address them today. Please feel free to express any concerns or questions you may have. And then we're going to establish the follow plan. So discuss a follow plan and schedule additional appointments to monitor progress and make further adjustment as needed. Okay, you can say something like this: let's schedule regular follow-up appointments to closely monitor your progress and make any necessary adjustments. I'm committed to working with you to improve your overall well-being. So in this consultation scenario, so if you apply this approach, which contains uh, active listening, empathy, collaborative decision making, um, we are addressing his chronic back pain. The goal actually is to build trust, validate the patient experience, and work together on a shared treatment plan. So this template you can apply in any angry patient scenario. So I repeat once more time the steps. First of all, acknowledge the patient emotions. Second is active listening. Third, validate the patient experience. Empathize and express understanding. Apologize if appropriate. Clarify the treatment goal. Go for collaborative decision making. Offer any alternative solution. Address any misunderstanding and establish a follow-up plan. And if you just follow this template, hopefully you will get good marks in your Mrcp basis consultation station. Thank you very much, my dear doctors, and I'll see you in my next presentation.